Hi everyone, I extend a very warm welcome to all listeners joining us today. My name is Jasmine Omboi and I am delighted to be your host. On this episode, we shall be tackling a topic on anxiety disorders with an expert who has been on this platform before. Make sure you listen to the very end because we get to learn about some medical conditions that mimic anxiety disorders. Let's learn a thing or two. Since the start of the global pandemic, COVID-19, I have experienced several panic attacks and I got to understand what anxiety was all about. It usually feels so scary and sometimes that feeling could last for hours. Thankfully, it's been months since my last attack, but I have learned how to handle situations better. Our guest today will tell us more about anxiety disorders, how they present themselves, and how to get treatment. I realize that many people are ignorant about this issue, so let's all equip ourselves with knowledge to not only help ourselves, but also to help others. Welcome. Hi, Hilary. Please introduce yourself to our first-time listeners and maybe just add by telling us what field in your medical career you enjoy handling the most.
Hey, ladies and gentlemen. My name is Dr. Hilary Tarus. I am a general practitioner. It's not my first time on this show. I appreciate you, Omboy, for having me back again onto this platform. I don't take it lightly. I had a very good time, amazing time the last time I was on your platform, Molimo Kipepeo podcast, of course. My professional interest is, I'm a general practitioner, in other words, a medical officer, but I have a keen interest in two fields, cardiology and of course, mental health. And I think what I can say about those two things, because they seem not to be on the same plane or on the same scale, if you know anything about the medical fields, is that there's the things that you want to do and then there's things that, that needs to be done. I want to do cardiology, but I believe there's a lot that needs to be done as far as mental health is concerned. So yes, that's where I am right now. So I'm a medical doctor who wants to do cardiology, but who needs to do something in the field or in the front of mental health, or at least try to like I said in the previous episode, I believe it was episode 18, steer this ship into the right direction. And me and Molimo Kipepeo met through his brother. His name is Dr. Philip Kirubi. He's a medical officer and in Coast Province. We were Kenyan students studying medicine in China, and that's how we got to know each other. So Molimo Kipepeo, thank you very much. I really look forward to sharing with you the topic of today, which is anxiety disorders.
What exactly is anxiety disorder and which type is the most common?
So first of all, to answer that question, I think it's important to, number one, indicate that anxiety is not necessarily a bad thing. It's actually a normal human emotion that was advantageous to our survival, because the world was not always this safe. 100, 200 years ago, the world was a much more dangerous place, and it would benefit you to be anxious living in that world of your surroundings. And I always give you an example. Say your great-great-grandfather was walking in the forest one day, and he had a tendency or propensity to be anxious about the things that are happening around him. So if he had footsteps behind him, some leaves crackling here and there, and he immediately assumed it was a lion because he's an anxious man and ran away, he stood a better chance of surviving than a man who was more confident and assumed that it was just the wind, on a bounce of probabilities. So just the feeling of anxiety is not necessarily a terrible thing to have. It is actually, it's how human beings have evolved psychologically to handle the world around them. So when is anxiety considered to be a disorder? In other words, how do we define anxiety disorder? First of all, there has to be the feeling of anxiety, but then again, it has to measure to a certain criteria, and the 4 criteria which we use to discern whether or not anxiety is pathological is that, one, there has to be, a significant avoidance of the said stimuli. It has to be the level of anxiety that interferes with your normal functioning. It has to be, disproportional to the threat that is before you. Yeah, and also it has to be persistent even in unthreatening situations. The most common is the phobias. The acute episode of the anxiety is usually precipitated by an exposure to a specific trigger, and the onset of the anxiety is predictable, unlike in panic disorder. So the patient may escape said trigger in the initial stages and then later develop a tendency to avoid them all. And there's three types of phobias. You have the simple phobias, which is you have agoraphobia, and then you have social phobia. So with simple phobias, you have a patient being developing a phobia for a specific thing, like a snake, heights, or frogs, or needles, spiders, whatever case it may be. You have agoraphobia, which is the fear of crowds, public places, leaving your home, traveling alone. Then you have social phobia, which is the fear of being the focus of attention, or fear of behaving in an embarrassing way in public. It may lead to fear of attending things like parties or like eating in restaurants, using public toilets, signing documents in front of others.
What are some of the common symptoms of anxiety disorder?
So the symptoms that you'd seen would, of course, depend on the type of anxiety disorders. There's about 10 types of anxiety disorders, but there's usually 6 main ones that you will come across in the medical field. You have generalized anxiety disorder, you have panic disorder, you have phobias, you have obsessive compulsive disorder, and then you have post-traumatic stress disorder, and then you have what is known as separation anxiety disorder. So just to tell you some of the symptoms you might see in each one of these, for example, in generalized anxiety disorder, you'll see muscle tensions around the shoulders and the neck. You have a patient who is restless and irritable. There will be difficulty in concentration. There could be initial insomnia, which basically means you are unable to initiate sleep. You could have symptoms like palpitations, sweating too much, shaking. You could have a dry mouth. You could have abdominal discomfort. You could have numbness. You could have what is known as globus pharyngeus, which is a sensation that there's something stuck in your throat, which is usually mostly misdiagnosed as allergies or a cold or a sore throat, whatever case it may be. And then when it comes to the case of panic anxiety disorder, you have these episodes of acute onset of severe anxiety that we call as panic attacks. So a panic attack can express itself as a sudden feeling of palpitations. You have your sweating. It can come as a feeling of choking. A patient can report of heaviness in the chest or difficulty in breathing. And most panic attacks might be misdiagnosed as an asthmatic attack. When it comes to phobias, you'll have the same symptoms that you'd see in all the other most of the other anxiety disorders, but these symptoms will be set off by exposure to a certain thing, a certain object or stimuli that you've developed a phobia over. Like, for example, if it's clown or heights, snakes, whatever case it may be. In the case of obsessive compulsive disorder, OCD, you find a case where a patient is obsessed. A patient has like a recurrent and intrusive, a very inane, unignorable, distressing thought or impulse or image arising from a subject's mind and recognized as such. It also involves themes of contamination, doubt, safety, symmetry, religion, illness, and violence. And also there's an element of compulsion attached to it. So you have two things. You have an obsession and you have an element of compulsion. And the compulsion, I'd describe it as a repetitive, an irresistible, time-consuming behavioral ritual that is performed in an attempt to neutralize the anxiety induced by obsession, despite the patient being aware that the ritual is unnecessary. A good example is during the height of the COVID-19 pandemic. There was a picture that was circulating on news feeds of a woman who was washing her vegetables with detergent, with soap. Yeah, it's a classic example of where you can see OCD take place. And then in the case of post-traumatic stress disorder, you would see the same symptoms that I've mentioned above, the sweating, whatever case it may be. But these symptoms would usually come after a traumatic event. You have a patient with the symptoms that I've mentioned of anxiety, but there's also an element of the patient underwent some sort of trauma or catastrophic event, and And then so those are just basically some of the common symptoms you see of in different anxiety disorders. Of course, it might vary from one person to the other depending on the type of anxiety disorder that they actually have.
How is anxiety disorder treated and diagnosed?
Diagnosing an anxiety disorder is actually a much more complex process than people would assume it would be. First of all, you'd have to establish that the feelings of anxiety the patient is having is pathological. It's not normal based on the criteria that I had mentioned before, like there's significant avoidance of the said stimuli. It does not, it interferes with the normal functioning of the patient, and also it's not proportional to the threat at hand. I'll give you an example. If I find you shaking and sweating and you're having difficulty in breathing, whatever case it may be, but then again, there's a lion 10 feet away from us, I will not rule you out as having an anxiety disorder, no. Because your response is proportional, is actually merited based on the circumstances that you find yourself in. Also, the feeling also has to be persistent even in a threatening condition. Fine. So once you've established this, you also have to rule out other conditions, that can mimic the said symptoms. And it's really incumbent upon you as a healthcare profession to make sure that you're, if, for example, a patient is coming in with chest pains and difficulty in breathing, before you rule that out as anxiety disorder, you have to rule out, asthma, for example, or any other chest diseases that would cause the patient to develop difficulty in breathing, or whatever case it may be. So you need to first also rule out all the other physical illnesses that can present in the same manner as anxiety disorder. And then after you've reached that point, you have to understand that different anxiety disorders have different criteria, different types of question you'd ask the patient so that you can narrow it down. Like, say, for example, you've established that the patient has anxiety disorder based on the first 2 points that I've put out. Now you want to know whether or not the patient has, could it be post-traumatic stress disorder? So you're looking for that traumatic event that happened in the patient's life. But at the end of the day, it's a very rigorous process, because you do not want to misdiagnose a patient with a heart problem as having anxiety disorder. That would be very catastrophic to the well-being of the patient. The main mode of treating anxiety disorder is based on two principles. You have psychotherapy and then you have medication. So psychotherapy basically, it means just talking to the patient, developing certain behaviors that help them to identify triggers of the anxiety, how they got to being anxious, and how they can self-monitor, how they can cope with the said situations. Now, in the case that does not work, you might have to employ medication. There's certain drugs. We have what are known as selective serotonin reuptake inhibitors. You have tricyclic antidepressant. You have benzodiazepines. You have serotonin norepinephrine reuptake inhibitors. These are just basically drugs that try to reestablish the chemical imbalances that are leading to your anxiety disorder. Of course, this is under the guidance and supervision of a psychiatrist or a healthcare, a mental health care expert. So usually in Kenya, what happens mostly is that people would resort to using drugs because there's a shortage of people to conduct. There's a shortage of therapy, so people to conduct this therapy. So we rely heavily on medication.
Okay, that's interesting. Then also tell us, what are some medical conditions that mimic anxiety? Because there are those that look like anxiety. It's not anxiety, but they sound like the same, because there are people listening to you talking about the symptoms and they're like, that sounds like something I could be having right now. Maybe that's not anxiety, it's something else. So what are these medical conditions that mimic anxiety?
Actually, those two questions connect very well. So, like I'd mentioned before, there are certain physical illnesses that can present, borrowing the same symptoms from anxiety. For example, if you're a heart problem, if you're having like a heart attack, you'll have palpitations, you'll have chestness, you can have dizziness, the same way as a person having a panic attack would be. If you have asthma, the same. One thing that you would see, in my practice, especially working around the CBD area, is a lot of people with panic anxiety disorder would be treated as asthmatic patients, be put on Ventolin inhalers, which really does not help. Diabetes as well would is a disease that would mimic anxiety. In other words, for example, if a patient is having an episode of hyper or hypoglycemia, they would have dizziness, they would have disorientation. Hyperglycemia would present with dry mouth, like I said it would before. Hyperthyroidism is usually presents very similarly to anxiety. Patient will be nervous, they'll have tremors, they'll be restless, and then they'll also be easily anxious. So it's incumbent upon you to check that the thyroid function of the patient. You have diseases of like irritable bowel syndrome will give you abdominal discomfort. It will give you butterflies. Lung diseases. So those are some of the common illnesses that would mimic anxiety disorder.
Tell our listeners where they can reach you.
So if you want to reach me, you can reach me on my Instagram. My name is Dr. Tarus. That's DRTARUS. At present, you can find me in Cardinal Otunga Plaza on the first floor. Karen Hospital Clinic. Karibu. Monyote mwakaribishwa. Tunatibu kila kitu. Mali kupotea, mapenzi, landlord kusahau kuitisha rent.
Finally, what is your parting shot? What is that one thing that you'd like people to remember?
In conclusion, I would say this, from diving deep into this topic of anxiety and anxiety disorders, and also from being in the same room with people with the said condition and interacting with them, I've come to realize one thing at a personal level, that anxiety disorder is based on two principles. One, the lack of control, or at least the fear of lack of control. And then number two, it's based on this innate self-realization that you're not where you're supposed to be, that you're not doing what you are supposed to do. Fundamentally, it's based on those two principles. And I would say there's very few things that life gives you the pleasure of having control over. You don't control where you're born, your gender, your race, or whatever case it may be, So for the few things that you can actually control in your life, you owe it onto yourself to take control over them. You cannot choose how much problems life will throw at you, but you can choose how you'll handle the stress and anxiety that life brings to you, because at the end of the day, anxiety does not solve any problems. If anything, it creates more problems, increases the risk of you developing cardiovascular illnesses in the future. It ruins the quality of life that you're living, and you live in a state of perpetual fear, which is not enjoyable. It's not where you want to be, and then second, if you're not on your path, get on your purpose. It will really greatly get to reduce the levels of anxiety that you have. And also certain things like social interaction, developing a new hobby, completing tasks, exercise, a balanced diet, proper sleep, simple things that will create a very huge difference in your life. So once again, Mwalimu Kipepeo, thank you for inviting me back onto your show. I look forward to the next session that we'll have. Thank you very much, and enjoy your weekends.
On February 18th, 1953, the movie based on a true story, Born a Devil, debuted in New York as the first ever 3D film in the motion picture industry. It was also the first feature-length 3D film in color and the first 3D sound feature in English. Born a Devil is a film set in British East Africa in the early 20th century with a plot based on the man-eaters of Tsavo. Now you know. Thanks for listening to this week's episode of Mwalimu Kipepeo. Please like our Facebook page for brand new episodes every week. Remember to like and share this episode with everyone you know. I'm Jasmine Ombwe. Let's meet next week for another learning experience. Ciao!